Talofa. My name is Alapua Poasa. I am from Samoa and I've been living in New Zealand for over 30 years now. Just feel like I just came yesterday. My role here at Tamarino Trust, I am the manager for the mental health and addiction team. So I hold a degree in counselling and addiction, a graduate diploma in counselling and addiction, a degree in social policy, and then a master's in professional practice, and an accredited clinical supervisor for DAPANS and a supervisor in the workplace. So those are the training that I feel it is a strength pace for me in doing this job, in supporting the community with the work that I do. Tamarino Trust, although we are a Pacific organization, but also we don't just work for Pacific. Anyone that needs support can walk into our door and we will try to tailor the intervention that meet their needs. One of the important model of care that we have been using is called Ngā Waka o Ka Inga Tapu, which is designed by 7 Pacific countries, so we can cater for to address family violence in New Zealand. Quite a lot of times that we see that people are very willing to engage, and the intervention model that we usually use is very much based on the values and the principle of Pacific people, and at the same time it can be applicable to anyone that come and seek support for Tamarino Trust. What informs our practice that Tamarino Trust, we do have a model of care that has an integrated model of care that focus on quality assurance, focus on engagement, and then also focus on cultural competency. We see that this is quite important because it can meet the needs of Pacific. And also we use other model of care that is also designed holistically. For example, the Whanawhale model. Seitapu model is a framework that align with competency of mental health and addiction. So we see that it's quite important to look at, so therefore we can see that we'll practice it in a safe manner. I had also developed a model of care called Lole Oliola, which is also inform our practice about working with especially with Samoans, because it is a Samoan intervention practice called Ifunga, but also it can be applicable to address issues of alcohol and drugs. And this model of care has really strengthened the practice that we have and we offer to the community. So therefore we cannot just think that this is what is best from our own knowledge, but also we look at what is important in the lives of people from the Pacific, and a model of care that is also relevant to their well-being and make us work together, understanding each other. So therefore it's designed to meet their needs. It's not something that we impose of them, but it is an intervention that is tailored around to meet the needs of those who we're working with. So our team is for mental health and addiction, which means that we work with those who need support for alcohol and drugs issues, and also for their families. We also work specifically for Pacific. So therefore we do have trained counselors who are specialized in alcohol and other drugs, and specialized counselors who are working specifically for Pacifica and also work with Māori. We do offer the service for minimization of problem gambling, and also part of our service is for camps, which is camps for children and adolescent mental health issues. And this is what we do, that we go out to the school and work with those young people at the school. So this is a very safe space that if you need support in those areas, you're very welcome, to come or contact us through the number that is provided on our website. It is a safe place. The counselors are trained, and we'll also make sure that we maintain confidentiality. Whaftai lava. E talo atu mana o mia lava se sosoani, a fio mai pe su mai e taltanoa ma le matanga luenga o iai foi le to mai whapitoa a wala sosoani mo le manuia o le atinu lau tere whaftai lava.